Growing up, when I was bullied, I felt very bad. Sometimes this thought comes to me, can I just change who I am?
When I was working as a site worker, I always see myself like someone who is less important, someone who is not up to a standard.
Then if you see me, I was so small, I just shrink because of drug use. You know, what the mother feels, that's what the child feels. I felt guilty because I knew what really happened to that child till death.
Nigeria is the most populous country in Africa, and we have had our fair share of the HIV epidemic. So addressing the HIV epidemic in Nigeria will save a lot of lives because we have the largest absolute numbers of persons that are infected with HIV in Nigeria. Now, for key populations, in 2007, a study that was done in Nigeria actually showed that key populations were disproportionately, infected with HIV or affected by HIV, and the data puts it at over, 5 times higher than what the average prevalence was for the general population. That was what gave birth to the Heartland Alliance IMHIPP project.
The reason why Heartland Alliance International works with key population is because key population is an integral part of the general population, which cannot be ruled out.
So for our key population, life is really challenging because, you are facing not just the health risk, you also have both social, and cultural and widespread societal stigma and discrimination to battle with.
Most times, the level of discrimination is what leads to the HIV infection because the person cannot talk to anybody, so the person keeps on involving, doing things that still keeps on exposing him or her to the virus.
Before Heartland, I did not have anyone to talk to. It was just me and myself.
Honestly, I didn't know anything of risks as at those years. I didn't know anything. And I was injecting with groups.
We are here waiting, my friend.
I have a lot of passion from the community I'm coming from because I know the humiliation that we used to pass through then. I know the humiliation, from the area boys, from the law enforcement agency, from the hotel owners, from the managers, and the environment in which you are living, from your boyfriend and other people. So there's a lot of humiliation to be a sex worker. It's something that one will not pray to be in.
So Heartland Alliance actually believes in people, and our approach is actually people-centered. Primarily, we're providing HIV services, but it's actually people-centered. It's actually human rights focused. And then the whole idea is actually to meet not just the medical concerns of the populations we serve, but to meet it in an integrated manner that incorporates both human rights, both their social and economic needs. So we have that empowerment piece. So that's one big approach. So 90% of our field staff, that are on the ground delivering these services are actually members of the communities themselves. So we have men who have sex with men, female sex workers, persons who inject drugs, who are actually HIV counselor testers, who are actually HIV peer navigators, who are actually community facilitators, and they form the bulk of our team.
Meeting Heartland Alliance, engaging myself, going to the community, talking to people, trying to stop myself from doing things that will make them feel I can't talk to them. So I feel everything about me is changed and I'm a different person being with Heartland Alliance. As a peer educator, educating them, I was so happy that I went out to see all that. Later on, I became a counselor tester. I could test, go out, talk to them, still bring them back to the OSS, so I was so very happy.
And that is the most reason why we have to make sure that we fight. Because statistics have shown that it is only sex worker who has the highest prevalence of HIV and AIDS.
Because of the way IMHIPP has brought everybody up, they are able to speak. Now you can see them hold cohort sessions, try to advise and try to teach. So IMHIPP has helped in a way that people now have built their self-esteem to accept who they are. IMHIPP have made us or people to be able to walk around freely.
Going into a one-stop shop, your psychology changes already because of the atmosphere. There's this aura of, I'm in a safe place already without anybody talking to you.
Even if I say you are HIV positive, you shouldn't worry.
You just have that safety feeling first. One-stop shops was birthed out of necessity because it was realized that outside passing prevention messages to people or meeting people were still having issues. People were still dying because they couldn't access services in public places because of stigma.
Our counselors are well trained and they provide services, HIV testing services to community members within their different spaces, bunks, hotspots, brothels, etc. And they are well prepared to manage whatever the outcome of the result is, be it negative or positive. In the last 9 years, across 11 different states, we have actually served over 500,000 unique, key population individuals with HIV prevention services, which makes us the largest key population program to date in Nigeria, and that is something we are really humble and proud of. Our definition of a champion is just anyone, anybody, anywhere, be it in your local community. Once you are a change agent, once you are giving back to your community, no matter the measure, you are a champion.
This is 388, 389, then you write 400.
I am an example of one. I started as a peer educator, but today I'm a different person. So I believe that you can do more.
My daughter's name is Esperanza. She's my hope because I lost her sister after childbirth. So I'm empowered. Like now I can pay for myself, pay for my child, even assist my parents.
I'm a champion. You don't know what champion is? I'm a winner. I have all these sex workers leaders are champions. They are champions. All of them are champions. Really, they are.
Most people don't even know their fundamental human rights. But this project has gone a long way to make people understand their fundamental human rights.
We are not supposed to be denied from job because you're known as a gay person. We are not supposed to be denied from fellowship. You're not supposed to be denied from your society just because you're known as a gay person.
I have the right to speak. I have freedom of movement, right to be educated, right to own a property, right to get married, right to bring forth children. It's my right to be human.
I'm trying my best to be a good mother to her. Trying my best. I know God will help me. I know I'm doing it.
Beyond, the great statistics that the program has achieved, which we are collectively very proud of. I think one piece for me that is really very critical, looking at the 9 years of our work, is how we have been able to build, communities, how we have been able to empower, individuals in the community who are now change agents and who are going to go out into the community, and actually impact many more than we have actually done as a program. So that ripple effect, that multiplier effect, that multiplier transformational effect within the communities, among individuals is something, personally I am, very excited and feel so humble about when I think about, the success of the achievement of this program.